Hello friends, welcome back to my channel. Today I will tell you regarding the role play that is based on hospital ward. So the setting is hospital ward. So before that I will tell you what all points you need to keep in mind. Okay, so first one is setting, second is background history, and the third one is the tasks. Okay, so all the tasks consist of action. So all the tasks are having action, different types of action word which all I will tell you later on. Okay, so according to tasks. So this is a hospital ward role play. That means it is a known case as patient is in the ward and also taking medications. Okay, so one thing I will tell you that whenever you start your conversation, it start should be good so that it will build your confidence, and through the role play you will be fully confident. Okay, so one thing again, next I will tell you within that 3 minutes you can find that it is a known case or unknown case or semi known case. Okay, so well, in this role play, the name of the patient can be partial. That means it is an optional because as it is a known case, if we can ask the name of the patient, we can ask in such a way to clarify or verify from the patient. So first, background is history here is you have come to check on a patient who is experiencing nausea as a side effect of his or her medication. So we can start with like this introduction. Hi, good morning. My name is Raman Gill, one of the registered nurses working in this hospital ward. Okay, then the patient reply as name, my name is David. Or if the patient didn't reply the name, so because it is a partial, so we can verify the name from the patient like this. For the verification, could you tell me your name, please? Okay. So like this, our introduction will be covered. Next is first task is explain the reason for seeing the patient, assess nausea severity, check vitals, review medication history, and find out how he or she is feeling. So here we can start like this. Mr. David, I'm here to assess you because you mentioned that you are experiencing nausea. Okay, so um, before moving further, could you please tell me how are you feeling today? Or we can also construct this phrase like this. How is everything going for you today? Okay. So like this we can construct the phrase. So this is the first task which is completed. Then next is the second task. Next, second task is provide information on the way to manage nausea, adjust medication timings, offer nausea medication, encourage small and frequent meals, adequate hydration. Okay, so as we can ask from the patient, how are you feeling? Then the patient will reply or giving us the problem that he or she is having nausea. Here the patient is David, so he will complain like I am having nausea. So before that, initial assurance is very important. As I have already mentioned in my previous video that always initial assurance, then the task, and next is the understanding of the patient. These 3 points please keep in mind while constructing the task, okay, or construct the sentence. Okay, so as here initial assurance is I really understand that it is very difficult for you to cope with nausea, but don't worry, I am here to give you some detail regarding management of nausea. Okay, so here provide we can change with gives and information with details. Okay, so like this we can strip the sentence, and along with this we can also set to the patient that, well, Mr. David, I will adjust your medications timings, and also give you some anti-nauseatic medicine as per doctor's orders. Okay, and also you can take small and frequent meals along with some fluids to hydrate yourself. How does that sound to you? So please use this formula. According to me, when I have given my exam, I use this formula. First is the initial insurance, then is task, and then is the understanding of the patient. Like here, understanding of the patient is how does that sound to you? Okay. So next, the patient will say that is sister, it is good. Okay, so next, another task, third one is restrict the request to stop the medication immediately, not possible, part of the treatment, other other option solutions, etc. Then is explain the importance of completing medication, effectiveness, building resistance, full recovery, etc. Outline alternative solution, dose adjustment, alternative medications. So now I will tell you how to construct the whole sentence like this. Resist is a action word here. So first of all is the assurance here. So we can say to the patient like this, I understand your concern. Okay. Or we can also say, I am afraid to say that, but it is not advisable. So we here we can say that it is not advisable or it is not possible to stop your medication immediately. Okay, because it is the part of your treatment. Okay, so there is also other solution rather than to stop your medication. Okay, so next staff also tell, as a sister we can tell the patient, also I will tell you the importance of completing medication as it is very or it is better effective and help you in building resistance and aid in full recovery. Along with this, other alternative solution is there we will adjust your medication dose and give you some alternative medication. So is that okay with you? So again there is assurance phase, then is the task, and last one is understanding of the patient, and understanding of the patient is that okay with you? Okay, so next another task is fourth one, that is advice on further steps if nausea persistent, that is reviewing prescriptions with the doctor and other underlying causes, and then is the dietary modification, etc. Find out any other concerns. Advice, before advice we can ask from the patient, is there anything you want to ask? Then the patient is having problem, and patient will ask you the questions like, sister, if I have a persistent nausea, what I can do? So as a nurse we can motivate the patient to ask more queries. We can say to the patient, oh, this is a good question from your end, I would like to advise you more steps if you have a persistent nausea. Okay, so I highly recommend you firstly review your prescription with your doctor, and the next secondly is check any other underlying causes, and thirdly please make changes in your dietary pattern. So well, that be okay with you? Okay, so after this all we can ask from the patient that he is okay with your options or your suggestions. Okay, then another is the find out any other concern. So we can ask from the patient, do you have any other concern to ask? Okay, then the patient having a problem regarding his care, and the last task we say that reassure the patient about their care. So patient is having problem with their care. So being a nurse, we can say the patient, I understand you are undergoing tough time, but I assure you that you are not alone. We are here to monitor you closely, and also make some temporary options for you to improve your comfort level. So, and last is obtain consent to proceed with assessment. Means, may I have your consent to proceed with your assessment. Like this, we have to construct the sentence and at last say, thank you for your consent or thank you for allowing me to have your assessment, Mr. David. And at last tell the patient, thank you for your cooperation. I hope I have cleared your doubts regarding the role play. If you have any query, please do comment me. Thank you for your listening. Thank you once again.